Good afternoon. I'm Bob Dempsey, and for the Department of Neurosurgery, we're giving a brief update on COVID. We're now 5 months into our part of what is really about a 9 to 10 month worldwide pandemic. There's new news, there's old news, and my message today is to mix the concerns about the recent events with a tremendous amount of hope and a admonition that it's time to get on with life and celebrate it. Let's see why. Well, first of all, the world itself. We have 20 million confirmed cases, 750,000 deaths. That's known. The United States, amazingly, is a quarter of that. I mean, that's ridiculous. This pandemics are diseases of developing and low and middle income countries. That we lead the world in this doesn't say much about our ability to simply follow simple rules. The best place to be in the United States is Dane County because we've been following the rules better than others. We have only 38 deaths in Dane County. That's amazing. We've had thousands of cases, but we've been able to keep people healthy and we've been able to keep each other healthy by the three simple rules. Wear a mask, wash your hands, repeatedly wash your hands. That's the most important thing. And then keep distance. What the mask does mostly is give people a warning that they're taking it seriously and to remind us not to touch our face and mouth and to make it abundantly clear that we're going to separate. That's important. You put this disease in perspective and you can look at all the figures worldwide and the vast number of unreported cases worldwide. This is probably 5 to 20 times worse than the flu. Okay, as far as it's very infectious, has a high death rate, and its death rate has a lot to do not just with attacking the lungs, but with stimulating an immune response, which can be too much. These are all things we've talked about for the last 5 months, and it all makes sense. It all begins to make sense. The more we understand it, the less afraid we are, the more we can do our lives, our jobs. And the concerns, though, as we look at this, is that understand this may be 20 times less virulent than the 1918 pandemic, maybe even 40 times less virulent. It's hard to tell till we look back at the world's effects, but it's not really that bad. And so we, unlike those days, have a lot of people who are asymptomatic carriers. That's a concern for a very infectious disease, but suggests not everybody responds the same. And when we begin to understand who does well and who doesn't, we begin to get lessons as to how we decrease the death rates, even while we're trying to figure out a vaccine. And I think that's really important. There are some major new concerns as we look at asymptomatics. One is common sense. Although we weren't seeing a lot of disease in children, it didn't make any sense that they weren't getting this very infectious disease. And now as we begin to test children going to schools, we see that quite a few children have caught this disease and can spread this disease and can carry the virus. They probably mount the immune response differently. We know that some adults seem to respond very well to it, and it may be because of their exposure to other corona-type viruses from the common cold or from other vaccinations. Very, very early. But as we begin to understand that a lot of this has to do with individual response to the disease, we seem to be cutting it down on the very sick patients by bringing that cytokine response down. One of the first things we talked about back in March and April was this response to the disease is what makes you feel so sick. Well, that is something that our elderlies cannot overcome, and they often pass away because of that. That's something our children may not mount in such a high degree. If you've ever seen something like that happen, or if you're very allergic person, you'll understand what I mean is that's a very frightening thing. It affects all systems. And that is really the second worrisome feature, and one that really is causing people to have some pause when they think, gee, I don't see anybody dying of this, is that what happens with chronic diseases. And that chronic response, which is primarily injury to the vessels of the brain, the heart, and the kidneys, is what we're becoming concerned about in some people. We know that there have been major professional athletes that have developed inflammations of their heart after what seemed to be a more minor COVID case. We know that the brain fog is going on for months in many people. And just to put it in perspective, when I was an intern in the 1970s, we were still seeing numerous patients with delayed degenerative brain diseases from the 1918 pandemic, a delayed effect. So there's lots of reasons to take this seriously. There's lots of reasons to take this as a threat, but that does not mean anybody panics. We know that this multi-system disease can affect all ages, but like anything, it's more dangerous to the elderly, the weaker, the immunocompromised, etc. So why are we doing better? Why is there reason for hope? Well, because we know what to do. It is common sense. And those countries and regions like New Zealand that have done that have eliminated the disease. It's very few that have done it that effectively, but it can be done. And we're beginning to get better at treating people before they get extremely ill. And we have hope for vaccines. As you may know, there are many, I think 30, that are in development now. Will they win? Will they solve this? Will this be smallpox? I doubt it. There are very few vaccinations that have been that successful. If this knocks it down or is another tool, we'll be lucky. Now, how long does it take to develop a successful vaccine? 4 years. We're trying to do it in 8 months. The Russians claim they have done it, but they forgot to test for it. They're going to start their vaccine in all their teachers now. When I see the politicians taking the vaccine, I'll say I told you so, because it's not tested yet. In the US, there's great pressure to go too quickly. I think that's foolish. We've had mistakes made with vaccinations in this country, and that could devastate our ability to vaccinate for the diseases we have good vaccines for, like measles, a far more infectious disease. So we need to be living with this disease. Now, what does that mean? Well, it means that we can't be in large groups, which means a lot of the events we had, concerts, sports events, are just on hold or are adapting to the times. They're adapting to times through electronic means, through electronic presentations. It's not the same, but it is what is happening this year. And this year, our lives are different. They're going to be different. This is something we've not done ever before in our time. I mean, we met all other major catastrophes together. Now we're having people more isolated. We should not completely isolate socially. We should just distance. And you can do that. I mean, we're learning how to put chairs around your front yard and have friends over, to talk, to make sure you check on them. That's important. And so what I'm really saying that a lot of the things that are happening made sense. You knew the university was going to open. It's what they do. It's what they must do. They must do it differently. There's going to be in person, but it's going to be distanced, but that's small groups. The big groups are going to be online. You knew that if a sport, an entertainment could be done electronically and had a small number of participants like golf or singing, you're going to see a lot of it. If it's something that requires a lot of participants and they're 18-year-old boys that maybe don't follow the rules, it's going to be in danger. And if that sport requires a lot of ticket revenue, like college football, it's not going to happen because they're not going to be able to pay their way. So they're going to wait and hope they could sell tickets in the spring, and that's exactly what's happening now. Other events like professional basketball are heavily reliant on TV revenue. They can isolate the players, put them in a gym, play them on TV, it'll happen. But bring a large number of people to come and watch it, no, that's not going to make much sense, at least until this calms down. Now, if you look carefully at the figures of the last month, there's been a distinct drop once we got serious about masks. I mean, that's been the symbol, but it's really just a symbol for keep your distance. And when we did that with dropped, we had this catastrophic increase in the month prior to the last 2 to 3 weeks when we just decided, well, let's open up. That was a mistake. We were declining, and now it's increased at a time that usually viruses don't. As we go into the fall, we're going to have to be strict. And I predict if we are, we'll have a much less of a flu season because the same factors that which transmit COVID. And that's cool. Now, what we need to know is that this is our reality. And we're good at taking care of crises. We are the University of Wisconsin Department of Neurological Surgery. We do crisis every day. So let's take those rules and let's celebrate. Let's celebrate who we are and what we do. This is why I'm optimistic, because I think I know where we are. I think we're in it for the longer haul, probably into the new year, but I think it's time to get on with life and count your blessings, quoting my mother at this point. This is the time to walk in the woods. It's a beautiful place. Other places can't do that. It's the time to count your blessings, to look at an oak tree and marvel at the strength of a bur oak's limbs, to embrace your family. So what I'm saying is that life is short and this is your day. Don't wait to say, gee, I can't wait till COVID's over. That's a true feeling, but don't live your life like that. Don't live your life thinking that, gee, if I can just get it past the election or past this event or this presentation or that surgery or this crisis, life will be all right. No, what we have to do is make today all right. And there are ways to do this. Because if this is your day, remember, bad things happen. We all will have misfortunes. The issue is today how you respond to it. And doctors are real good at that if they think about what their base job is. We respond to a crisis with wisdom that's based on experience, and that's why we've been keeping track. We've been looking and reviewing what's going on with COVID. What can we do better? What are the simple rules? And why do we stick to it? We respond with strength. That means perseverance. And we respond with compassion or empathy. If we understand how much this is affecting other people and making them frightened and making them isolated or making them hungry, not able to pay their rent, we understand that we have to address each of those issues or we will have violence, war, civil unrest, as we are having now. And if we do not think of those rules of engagement and compassion as countries, we will have wars. This has happened throughout our history. That's why we must stop, realize that what our blessings are, embrace them, and get on with our jobs. Because our jobs are important. What our base jobs are, be they taking care of food or farming or medicine or patient care, are what we're proud of. And so we aren't perfect, but be grateful for what we have. Appreciate those things and don't focus on what we don't have. I have been doing that, and that's something I have to get past. There are lots of things I want to do, et cetera, et cetera. There are family members I want to check on. I'm going to have to find better and better electronic ways to do that until I can travel. Although I did rent a truck that had 700 miles to the gas tank, drove down, took care of one, and drove back. So yeah, there are the adaptations. Be grateful for what you do and then target achievable goals. If we want to persevere through something like this, we take it down into chunks. What can I accomplish? What's my job? Well, if it's research, do it. If it's teaching, do it. If it's patient care, let's embrace it and let's be proud of it. It's that sort of gratitude mindset that I'm talking about, where you will be able to say, hey, this is a difficult time. Crisis brings out the best in people, and we are blessed in this. There's so many other problems in the rest of the world. Living in Beirut, which has been leveled, we're very lucky. And this is the time to grow yourself. Look at the things that you care about and do them well. Read, do your hobbies, learn, be proud of yourselves. Grow and achieve, because what you do is important. And I don't care if it's as a staff person, as a farmer, as a mechanic, really important part. Be proud of it. If you're fortunate enough to be in healthcare, we do something that is meaningful every day. We can affect people's lives, each of us together. No one person does that. The entire neurosurgery team is invaluable. And what we're achieving in a crisis, in a very busy time, is remarkable. It's absolutely, because for a while they shut everything down. And with everything shut down, our patients suffered. They had strokes. They didn't have their growths evaluated. They didn't have their breasts looked at. Their baby shots weren't taken care of. What we do as doctors, as nurses, as staff, as people that make the health system work is invaluable. Be proud of it. Be grateful for it. And let's do it. Because we're going to be doing this for a while. We're not going to be watching college football for a while. That wasn't the most important thing. Life is different. That's very upsetting, but life is still very good. Embrace what you do. Embrace what your family does. Look after them. You know that UW is going to be open. It's going to be different. There'll be very little travel. Very much will be electronic. We're holding a meeting Saturday with the world of the developing countries to see how can we do it better? What are your needs? How is COVID affecting you? That's humbling because, our problems are small compared to theirs. So do what we do, which are our core values. Sometimes we got at the beginning of this too focused on COVID and us. Our core values are to take care of people who need medical care. If you have research to do it. You can do it. It's different, but they're going on very well. If you have teach, do it. Patient care, very proud. And embrace the good. Think of the things that have happened. Dr. Bashakaya has been given an endowed professorship. Dr. Rahil Ahmed, a new important grant. Dr. Alish, a new NIH grant. Each of us have our triumphs. They're important. So learn from this and finish each day a better person by meeting the world as it comes to you, embracing it, making the best of it, and leaving it a little bit better than you found it. This COVID crisis is a real one. We're responding to it sensibly. We're all working hard. It's going to be different. And I'm going to learn a lot more about electronic communication. You all will. And we'll keep going. We'll keep talking to each other because that's the way we learn. And as always, I'm very, very proud to be part of this group. I'm very proud of you all. I'm very proud of what you allow us to do. So my thanks are real. I want you to thank each other. I'm proud of you. Take care now.